coaching and developing your other team members. And this all too often seems to be the one that nobody wants to do. And one of I kind of pull my hair out a little bit when I hear people say, well, isn't there just some website I can send people to? Isn't there just a DVD I can order? Or can't somebody just come to my office and do it for me? And I would say to that, it's just too important. The answer is yes. There are outside resources that you can use to help train your staff, but I would use those as supplements to your own internal process. I don't think there's any website or any outside individual or group that can truly understand your brand, your culture, your goals, your core values. I think you have to be involved with that. And even when we're talking about metrics and numbers, if you've got an employee that needs to be coached up, that needs to hit a certain level, if we're talking about production, so often that simply becomes a training issue. I ask this question live. I'll look at the group and I'll say, how long does it take you to train a new hire? And I'll get that question sometimes. How long should it take to train a new hire? So when I ask that question, I give them a minute, and you get a variety of looks back at you, and is it 30 days? Is it 90 days? And then I tell them, don't answer this because it's a trick question. If I were to rephrase this to say, when does training end? Then you see the light go off. And I think we all agree training should never really end. And maybe it's a semantics issue. I realize that there's an original, let's call it an onboarding process, where you have to make sure that people have at least the rudimentary skills to be able to competently do the job. But at the same time, I don't think that should ever end. I think we've all been to businesses before where it became very clear, very quick, whether or not there was a highly engaged process of continuing to develop the employees. I think we really recognize and appreciate that as consumers when we're doing business with an organization that has highly invested in their team. And I know the pushback on this. It's going to be, I don't have time. The same thing we talked about before. And I'm sensitive to that. I realize that these most optometric practices we're talking about are small businesses with limited time and limited resources. But let me share with you something that I learned on what it could look like to provide that employee development, that coaching in a practice that doesn't have a lot of time to do it. And I'm drawing from my own experience. I was practicing at one point, and I would frequently hear the technicians. Well, the patients would ask a lot questions that many of you have probably heard. What does that ear puff thing do besides just, blast my eye with air? And the opticians, I would hear them say, just ask the doctor, he'll explain it. And it really didn't instill a lot of confidence, in my opinion, in the staff. But it was our fault. It wasn't their fault. Nobody had ever explained to them what the test did, so how would they have an answer? So one day what I did was called all the technicians over, and I said, I noticed that people regularly ask about that test. I'd like you to be able to have an answer. And I just spent about 5 or 10 minutes going over the test and what it checked for, how it got a reading, what normal readings were. Spent a little bit of time, didn't go into great detail, but we talked about glaucoma a little bit and how that pressure can affect the inside of the eye and the optic nerve. And I showed them a picture of what a normal nerve looked like and a nerve that had been damaged by glaucoma. And I noticed something really interesting. From that point forward, when people asked what the ear puff did, they not only had an answer, but they almost seemed proud of the fact that they were able to answer that question. They almost took pride in their answer. And what I came to realize was that to continually develop your team, you don't need a lot of time. You just have to take advantage of the moments you have. And what I started doing was taking advantage of these, what I like to call 5-minute moments. When you see a patient that was, you pull them over and say, that patient that was sitting in the waiting room in the fetal position in tears, he had a corneal ulcer. This is why we have people take their contacts out at night, or why we stress wearing daily disposables. Let me talk to you a little bit about what a corneal ulcer is and how painful it can be. Or that patient that came in and couldn't see out of his left eye, That was from diabetes. Let me talk to you about why we stress so much our diabetics coming back once a year so we can check them. So if you want to develop your staff, be a teacher. I've really come to appreciate that over the years. Take advantage of those teaching moments. Every day you walk into the practice, there's these 5-minute teaching moments. Take advantage of them. It'll really pay dividends over the course of time on the knowledge and competencies of your staff, and that will not go unnoticed by your patients.